Good morning, everybody. You know, The Last Wonder of Mars is not a political channel. We're all about kittens and trees, floating skulls, stupid things to do in a hurricane, flying drones, or exploring the world underwater. But certain comments and promises and outright lies being told during this incredibly, during this incredibly dreadful election year has kind of prompted me to speak out and make this trifle of a film. So, let's talk about healthcare.
Hello, and I'll be your surgeon this morning. Yes, I know. We met a month ago when I set this up. Oh, yes, you're Fred, and I'm supposed to fix your shoulder. Knee? Gunshot wound? No. I'm Davy, and you're supposed to fix a hernia. Oh, yes, of course, I knew that. Do you have any questions about the procedure? Well, am I going to have to be here overnight? Overnight? Oh, no. No, that's like dining in. The dine-in option is for people with better insurance than you. This place is like the drive-thru, sort of like cut, sew, and go. Oh, okay, well, is this going to hurt much? It all depends. Will this be cash or check? What's that got to do with it? We also take plastic. I was going to use a debit card. Excellent. It won't hurt a bit. Well, when do we start? We shall begin as soon as the anesthetic kicks in. Anesthetic? Oh! I should say, right about now. I believe this is my dance. May I cut in? Now, let me see. No, that's not it. Rats, that's not it either. I know it's in here somewhere. Aha, there it is.
Now, I'm not saying with this little cartoon that all doctors are elitist, money-grubbing slime, although that is mostly true. No, all I'm saying is that when you talk about wellness, medicine, doctors, and health in general, what you're actually talking about is big money. Huge money. You're not talking about caring. You're not talking about fairness. You're not talking about the Hippocratic Oath. You're talking about bucks, dollars, dinero. Once upon a time, healthcare meant the kind of care and service you got from your friendly family doctor. But now, healthcare is synonymous with and can actually be defined as insurance. Now, insurance is like a crapshoot. You pay a company for a policy that says they'll pay for your medical expenses should you ever need them, taking your money, gambling on the idea that you won't. Now, they invest the money you give them every month so that there's plenty of money to pay off doctors, hospitals, imaging centers, labs, and everybody else with their hand out should you get sick or hit by a bus or miss a skateboarding trick or something, and still have plenty of profit left over for themselves. This is, of course, an idiot's version of how all this works, because it sounds fair and reasonable, which, of course, it isn't. Your motivation is to have your medical bills paid. Theirs is to make unbelievable piles of money at your expense. But medical insurance, scam or blessing, is a relatively new idea. The first known policies were issued around the time of the Civil War, but they were limited accident policies for train and ship passengers. The very first group health care policy wasn't created until 1929, when a school paid a local hospital a monthly stipend to take care of its teachers. Now this idea, the idea of industry offering medical care coverage as a benefit of employment, soon caught on, and by 1935, many industries were attracting top workers with the dangling carrot of free health care. But so far, the government wasn't involved at all. In the 1940s, when Franklin Delano Roosevelt was creating Social Security, he tried to include an extensive health care program for retiring seniors to go along with it. But Congress didn't want to enter the health care arena, and the American Medical Association wanted nothing to do with government control. So it wasn't till the days of the Vietnam War that Lyndon B. Johnson, A, escalated troops, and B, signed Medicare and Medicaid into law, and finally, the federal government was involved in health care. Unfortunately, Medicare is pretty much what you would expect from the government.
What do you think of this? You like it?
By itself, it's practically useless. Now, even though you've paid through payroll taxes, whether you wanted to or not, your entire working life, when you try and cash in Medicare, you find you've only paid for part of it, hospitalization. And if you want to see a doctor, well, now you have to pay even more out of your Social Security, which by itself puts you lower than poverty level. But if you do decide to pay for the medical portion of Medicare, what you get is a policy with a nearly $600 deductible that only pays 80% of approved costs. And you'd be amazed how many of those costs are never approved. Now, with this level of astute, helpful involvement in the healthcare industry, it should come as no surprise to anyone that the feds wanted to screw around with it even more. And thus was born the legacy of President Barack I live in the back pocket of big business Obama, namely the Affordable Care Act, colloquially known as Obamacare. Now, this little gem made Medicare better, but only if you paid even more for something you've already paid for. It increased the responsibility of employers to offer health care to their employees, and if you didn't have a job, it created a marketplace where you could find supposedly affordable plans. And to prevent people from saying, if I had money, I'm going to spend it on cheap wine rather than cheap insurance, the act made it a federal crime to not have insurance. Buy fucking insurance, you loser! Well, the mandate making it a crime was repealed, but the rest of Obamacare stayed intact. Making sure everybody is covered sounds like a good idea, and I'm sure at least part of the government's intention was righteous. However, just like Medicare, Obamacare is pretty much useless. You scoff? Well, let me tell you a little story. In January 2020, I was working as a deep-water lifeguard at the Volcano Bay Resort in Orlando, Florida. As with all hourly jobs at Universal, it was a part-time job. Now, before Obamacare, only full-time team members were offered medical insurance. But after it was passed, they offered this policy for part-time workers. But then, mysteriously, my knee started to really hurt. It got to be troublesome to try and walk around. Now, I never really knew how I hurt it, whether it was a bicycling accident or whether it was something at in-service, which it very well could have been. Now, the fact of the matter is, I have absolutely no idea at all how I managed to injure my knee. It could have been in that in-service, because after all, I was carrying a rather heavy guy out of the water on a backboard with a fairly small girl, and I did trip and fall in the water, in the very shallow water, like 2 inches of water. But I don't remember if I didn't fall on my knee, and I don't remember twisting it at all. I just tripped and fell on my ass, basically. So I doubt seriously I did it then. There was a time that I kind of almost fell on my bicycle, but I didn't twist it then, so I have no idea how I did it. And because of that, I couldn't use workman's comp or anything to go and look for it. I had to go to a doctor myself. So I went to the clinic, which is called Team Care at Universal, and didn't actually see a doctor. I saw a physician's assistant, which is like a junior doctor, from what I understand. They're a healthcare professional, and they can diagnose. They can give treatments and diagnose illnesses and whatnot. And according to what I read, they rarely assist physicians, so it's kind of like seeing a doctor, although it's not a real doctor. I don't know how these things work. She took one look at it, said she wasn't really sure what it was, and sent me across the street to have x-rays done. Now, I had to wait a week before I got an actual call from her, and she looked at the x-rays and said she had no idea what the problem was. The x-rays didn't show anything. But see, then again, x-rays, the only thing x-rays ever shown are bone injuries. But if you got soft tissue damage, they're not going to be able to find that. So after waiting a week, I still got this problem, and it's still nagging going to work every day, because I'm working at Volcano Bay and standing lifeguard shifts and on stands and whatnot. Now, anytime I'm in the water, it was fine, but the very idea of climbing the volcano, my God, that's 18 stories tall, 202 steps, with a bad knee. Yeah, excruciating pain. So I went to my own physician, Dr. Greaves, who I've been going to since 2005. Now here's the whole thing. She's a principal care provider. And a principal care provider used to be just like a family doctor. You would go to your doctor with a problem and they would solve it. If they couldn't solve it and treat you, then they would probably send you off to see a specialist somewhere. But now, PCP is nothing but a referral service. So all she did was take a look at my knee and take a look at the x-rays that had already been done. She sent me off to the Jewett Orthopedic Center for further evaluation, so to see another doctor. Now, I wasn't too crazy about going there, because that's the place that 10 years ago had treated me for this broken wrist, which I broke in a skateboarding accident, actually a longboarding accident. And the first thing they did when they looked at this was say, "Oh, you need surgery." And I said, "But it's a hairline fracture. Why do I need you to cut my hand open?" And I refused it. So they put me in a cast for 6 weeks, which was, wow, and it put me out of work, and oh my God, it was terrible. So I wasn't too happy about going back to them, but that's what I had to do. So I showed up there, and the first thing she did was send me in for more x-rays. And I said, "Well, I already have x-rays." And she goes, "Yes, but we like to do our own." So she did some x-rays, she took a look at it, she goes, "I think it's probably a torn meniscus," which of course is another surgery situation, because, "But we won't know, so you need an MRI." And I said, "My insurance doesn't cover that." And that's where it ended. So now let's look at these bills. Now, first there was the physician's assistant, who billed the insurance company for $224 with a $10 copay to me for a 15-minute office visit. Next was Simon's Imaging for x-rays. They didn't state cost, but generally speaking, the x-rays are about $200, so we'll say about $195. And they did state my $25 contribution. Then there was my doctor, Dr. Greaves, who billed the insurance company for $226 for an office visit, with my copay being $15. And then there's the Jewett Orthopedic Center. Dr. Robinson charged $328 for an office visit. Another $195 for additional and, may I add, unnecessary x-rays. And my copay here was a whopping $80.60. Now that brings the totals to this. $1,168 was billed to my insurance company, and I was forced to pay $130 in copays. See, and this is where the problem is. They billed a lot of money for this, and they sent me to a lot of doctors, took x-rays. Probably one wasn't necessary, two was certainly unnecessary, but the one thing that never happened was they never treated my knee. Not as much as a cold compress and an aspirin. They never treated my knee. They just bounced me around to more doctors and more officials. And here's the problem with Obamacare. Now, the way the insurance company works with the doctors is the doctors are allowed to charge anything they like for their service. There's no restrictions, there's no pricing caps, there's nothing. They can charge whatever they want. Now, the insurance company deals with doctors in their group, and they negotiate a discount price that they're going to get for all their goods and services. And that's what they pay, and that's what you end up in a copay. What the doctors charge initially is totally unfair. And even the discounted price is totally unfair. It's just a game. It's a scam. Need another example? Swell. In 2017, I was in a motorcycle accident. I was able to get the bike up and drive myself to Orlando Hospital Emergency. Once I established that I had insurance, they took me to a little room. Over the course of 4 hours, they took 3 sets of x-rays, a nurse gave me a tetanus shot, and a single ibuprofen pill. A candy striper bandaged me up, a doctor poked his head in and said there was nothing broken, and that was it. The bill from the hospital was $4,054. The agreed discount to the insurance company for the insurance I had at the time was $2,659.43. So what the insurance company paid was $1,219.58. My copay was a standard, according to my plan, $175. And that included the charge for the single ibuprofen pill, which, after the discount, was billed at $12.38. The original charge for the hospital was $36 for that single pill. Now, with Obamacare, with this cheaper insurance you get, you don't pay as much for it, and so they have to treat you using it. They don't get to charge you as much as they did. So, instead of getting treated, you just get bounced around. Lots and lots of doctors, lots and lots of unnecessary tests. And it would have gone on, I guarantee, with this knee. It would have gone on to MRIs, which are extremely expensive, and in whatever other tests they could have thought of too. Now, back in the day, I would have gone to my family doctor with this same knee problem. He most likely would have looked at it, said, well, you got full mobility, I don't hear any clicking, there's not a lot of heat into it, it's a little bit swollen, so you probably just twisted it. So here, I'll give you a shot of steroids, I'll give you some painkillers, stay off of it and use cold compress for a couple of weeks, and if you still have a problem with it, come on back and we'll see if we can't take care of it. And that's how it would have been dealt with. But that was back in the day. Now seriously, insurance is not the answer. Obamacare, Medicare, and it doesn't matter, insurance is not the answer. Somebody needs to make doctors responsible for what they charge. I know back in the 80s, if you went to a county hospital in Southern California, you didn't pay a lot to go to a county hospital because it was paid for with property taxes, meaning you already paid the freight on it. So they're not going to charge you for it again. It's just now, with no restrictions, doctors, they can charge whatever they feel like. And if you even call them on it, here's the 2 responses you'll get from doctors about how much they charge. You might get, as I've heard both of them, well, that might seem like a lot, but exactly how much is your health worth to you? That's one. The other most standard one is doctors will look at you innocently, like just they don't have a clue, and they go, well, I really don't know how much I charge. I in the front office takes care of all that. As if that exonerates them from anything, because their front office doesn't. So at any rate, in this political climate, with everybody going on and on about Obamacare and wanting to extend this and more insurance here and more insurance there, it's not the answer. So, I've given you examples. Make if you like. Consider me a fool, if you like. So I might be. But, like I said, I couldn't help but contribute during this particular political season. So, that's my spin on healthcare. If you agreed, leave me a comment. If you don't agree, leave me a comment too, but try not to be too rude, huh? See you next time with another episode of The Last Wanderer of Mars.